कलर होऊन जसे I have started my career way back in 1981 in echocardiography, and that was only M mode was available. I spent a lot of years in M mode, about 4 or 5 years in M mode echocardiography only. So I still like that methodology, So let us start with that. So this is M mode cursor. As I told you, this cursor you can keep at aortic valve. You can see the aortic root, aortic valve. A clear picture should be taken and then press M mode. So aortic root measurement. This is the maximum dimension, this is the minimum dimension. You have to take the maximum one. Take from the I am just taking measurement. Here. Just this is the leading edge of the posterior wall of the aorta, and then go down. This is LA. LA is measuring 37. Okay. Then another here. This is aorta. Leading edge of the aortic root. You go down. This is aortic dimension is 36. Almost same. So there is no enlargement. Then, as I told you, you can also measure the excursion of aortic cusp. Here you can see the aortic cusp excursion. This is 23. If it is less than 19, this may be suggestive of some restricted opening. This is the central closure of the aorta. If aortic closure is not central, if it is eccentric, either close to anterior or close to posterior wall, then this is suggestive of bicuspid aortic valve. But it is central, so this is the tricuspid aortic valve. So this much information you can get from M mode measurement at aortic valve. You can see the aortic cusp is thickened. He is an old man, so this atherosclerotic changes, they do occur because heart is beating right from the time we are born, even before that, till I think he is almost 70 plus. So his aortic wall is thickened. Now this is not an ideal patient for M mode, because here you can see a bulge of the septum. This is called as sigmoid septum. This bulge is seen as the age advances, and one should not measure at this level. Although I told you should measure at mitral, but in this case this sigmoid septum is seen. If you include this in measurement, you will label this as asymmetrical septal hypertrophy, which is not there. So in this situation, you have to take septal measurement from here, excluding this. So these are the limitations of M mode measurements, but easiest way. उठून जायचं झालं. इसको रेगुलर करना था ना, जस्ट टू मेक इट. Just a moment, we are getting another patient. लेट जाओ सर, इधर कर लो सर. And repeatedly I want to communicate with that measurement should be done properly because they are needed in future. For example, patient who is on chemotherapy and there are so many toxic cardiotoxic drugs are being used, so they want subsequent evaluation of the patient whether he is getting cardiac toxicity or not. So then you should have more serial evaluations, and those serial evaluations are only possible if you have done it properly and if your results are comparable. Okay, so try to be more methodical in getting this these measurements. बेटा थोड़ा घूम जाओ उधर, जरा घूम सकते हो उधर. ठंड लग रही है क्या? एसी बंद करो यार. This is LVH, patient of CKD with hypertension. Anyhow, but we can take measurements. So just at the tip of the just beyond the tip of mitral wall, and here you can take is a patient of CKD with severe hypertension. That's why you can see there is a severe left ventricular hypertrophy. LV mass, LV, all. Okay, now as I told you, this is a diastole because the LV cavity size is largest. Okay, so from here is the leading edge of IVS till here, trailing edge of IVS. IVS is measuring 18 millimeters. Normal IVS dimension should be less than 10. So this is suggestive of severe left ventricular hypertrophy. Now this hypertrophy of interventricular septum. Now this is the left ventricular dimension in diastole. LVID, left ventricular internal dimension during diastole. Okay, from the leading edge to the from the trailing edge to leading edge of the posterior wall, which measures 44 centimeters, 44 millimeters. This is the posterior wall. Posterior wall is also thickened. When both the walls are thickened, this is called as concentric LVH. When only one of the walls is thickened, this is called as eccentric LVH. Now the next, here, this is the thickness of the during systole of IVS. This is thickness during systole of posterior wall, and this is the posterior wall thickness during systole. So here you can see the LVS, the left ventricular fraction is 40%. Okay, this is how it's very easy. You just have to just mark those things and you will get the very easy. But for that, the LV cavity should be normal. Okay, should be globular. Then only this is possible. So accordingly, this patient has severe left ventricular hypertrophy with reduced ejection fraction. You can study the mitral wall opening, closure. So this is the E wave. This is the A wave. EA of during M mode. You can see mitral M pattern. This is W pattern of the posterior wall. This is the central closure of the mitral wall. So various then measurements can be done on M mode. Okay, so let us move to now 2-dimensional. For that you need 4-chamber view. हिलो नहीं बेटा, हिलो मत, हिलो नहीं. This is called as area line method, by which you can calculate two-dimensional this thing, Simpson. Then 4 chambers diastolic. This is called as non-compacted part of the endocardium, that is to be excluded. That should not be included in measurement. This is what I am trying to exclude, the non-compacted portion of the heart. ये सिस्टोलिक है, आगे है ना सिस्टोल, अच्छा आगे है. Is Mr. Sharma, who is the application engineer for this machine, is kind enough to come here and supporting me, because this is absolutely new machine for me. We have little earlier version of similar, that is also very good. Where is EF? Okay. Just over. This is systole. This is diastole. Okay. This is systole. Which is this one? Okay. This is diastole. This is systolic. Here we have used 2 chamber and 4 chamber views. हाँ 40%, same 40%. Okay, so M mode does work as long as the LV shape is maintained, otherwise one should not use that. So that is how we can calculate ejection fraction, which is most wanted figure in any critical care or any hospital. Now this is for first dimension for RVOT at the tip of the right coronary cusp. This is measuring 30 millimeters. Okay, and here it can be another dimension which is almost 20 millimeters. These two dimensions for RVOT. Now 4-chamber view, you can again measure the volumes of the atrium. So LA volume, this is LA, right, slightly left atrium is slightly enlarged. So this is how we can take measurement of left atrium also. Now you can put a Doppler here. PW. Now वही Doppler because of tachycardia, you can see this E wave and A wave, these two are fused, almost fused. If you look at the velocities of E wave and A wave, EA ratio निकालना होता, EA velocity ratio, right, ये इसमें आएगा, था उसमें, जान दो, लिमिट, V1 V2, the E and A ratio is 1.9098. It is almost close to 2. So this indicates type 3 diastolic dysfunction. Okay, because you can also see that the velocities of E wave deceleration is reduced. Markedly reduced. So this is a clear-cut feature of type 3 diastolic dysfunction. क्या करना है? नहीं हो गया. Scale. कम करना है इसको, स्केल बढ़ानी पड़ेगी इसकी. Here we are measuring, so this 34 mm is very high. So this here all the features of type 3 diastolic dysfunction, where the PA pressure is almost 4 millimeters, very high. So this is all because of the left ventricular dysfunction. So see a rim of pericardial effusion. So this patient who has left ventricular hypertrophy, then dilated left atrium, then raised PA pressure, this is all secondary to type 3 left ventricular dysfunction, and this pericardial effusion is a part of CKD, that is chronic kidney disease. Okay, thank you. So this is how you should try to take the measurements. I will just repeat again. Diastolic, you can see the left anterior mitral leaflet, it opens up and almost touches the septum. In restricted flow, this may not open properly. So here again, measurement to be taken from here to here. This is the septum, which is thickened 13 mm. This is the posterior wall. This is also thickened 13 mm. So he has concentric left ventricular hypertrophy and left atrial dilatation because of type 3 diastolic dysfunction. Now let us move to next topic.